So good evening, everyone, and welcome to the folks here in person and also to the people attending via Zoom. We have some great speakers here this evening who have important information to share, so we'll get right to it. My name is David Lindsay, and I'm a member of the board of BCAMP, which is the Benicia Community Air Monitoring Program. We are a 501c3 nonprofit organization, and we operate an air monitoring station in Benicia with the expert technical assistance of our operating contractor, Argos Scientific. A special welcome to attendees from the Air District and elected officials. Here's our agenda. After a brief introduction about air monitoring in the Bay Area, we will hear about the health impacts of air pollution from wildfires, refinery releases, and industrial toxins. Next, we'll hear about the current status of air monitoring in refinery communities. Then we will hear about how Benicia's pending industrial safety ordinance will improve air monitoring in Benicia. We'll then move on to innovative monitoring technology being used in Southern California. Finally, we will share our vision for the future that can be implemented in short order if we work together to channel available resources. We'll finish with a Q&A. But please, in the audience, please hold any questions you may have until that time. Now, those of you on Zoom can write questions in the chat anytime, and we'll try to address those after the presentations. Talked enough. Our first guest is sitting to my left, Eric Stevenson. Eric is a chemical engineer with over 35 years of experience in the environmental field. He recently retired as a director of meteorology and measurement at the Bay Area Air Quality Management District, which I think is now called Bay Area Air District. Bad.
When we're bad, we're better.
In that role, he spearheaded the creation and adoption of Regulation 12, Rule 15, yay Eric, which requires refinery fence line monitoring. He has worked with various committees and work groups dealing with air quality issues on a local, state, and national level, including US EPA, to develop monitoring rules and guidance. He now works as the Global Director of Technology Innovation for Argos Scientific. Take it away, Eric.
Thank you. Do I turn this one off?
You're good. You're fine.
Okay, sorry about that. Thank you, board members, for having me. Thank you for coming out tonight and spending some time with me. I'm going to go through this really quick. I'm going to try and give you some basics of air monitoring and exposure so that when the more qualified speakers come up and talk, you'll have a better idea of what they're talking about. Next slide, please. Thank you. So, what is air monitoring? What's it supposed to do? Well, basically, it's a way to measure folks' exposure to air pollution. There are three main things to that: how they measure that exposure, how it's translated, how it's monitored. And there's these three things are scale of what population is represented by that air monitoring system. There's the compounds measured, right? Because if you're not measuring a compound, you don't know anything, right? And then there's the averaging time of the measurement. Data quality is really important because if you don't understand what the errors are, when it gets to the health folks, it's difficult for them to really draw solid conclusions if you don't know what the errors are, right? And it helps to inform good policy making on a regulatory scale. As far as exposure goes, ideally, to measure your personal exposure, you'd be having air monitoring near you all the time with good data quality and measuring all the compounds that you had potential to be exposed to. So remember that as I talk through these next things and where these kinds of differences occur. Next slide, please. Okay, so we're going to talk mostly about what the Bay Area Air Quality Management District or the Bay Area Air District does, because that's the majority of the air monitoring that's done in the Bay Area. Okay, they monitor for criteria pollutants. The list is there. It's carbon monoxide, ozone, oxides of nitrogen with a focus on nitrogen dioxide, sulfur dioxide, particulate matter, some people call it PM, in two different sizes, 10 microns and 2.5 microns. A micron is 1,000th of a millimeter, so it's pretty dang small. They also measure a variety of organic compounds at stations located throughout the Bay Area, specific types of PM, not just the size, but the composition of it. And then, of course, there's special studies that don't fit into any of these categories. And, we just don't have enough time to go into all of it. So I'm just covering the general stuff. Next slide, please. Okay, so what is scale? So in most cases, what you try and do with air monitoring is locate it in a way so that it represents a very large population. So intentionally, those monitoring stations are usually located away from pollution sources, residential neighborhoods, that kinds of things, because that represents a large population and what that population actually may be exposed to. So, you don't see a lot of monitoring stations near industry. There are specific exemptions to that. Near roadways, again, there are stations near roadways, but they're very specific. Distribution centers, things like that that have a very localized impact on that population. So those kinds of stations only represent small populations, right? So monitoring stations located near sources are, like I said, intended to represent those populations really close nearby. Next slide, please. Okay, averaging time, a lot of words. Sorry, I'm supposed to put pictures in my PowerPoints, but it just goes better this way, right? Here's what AI tells you averaging time is, and I've got a little example. So averaging time is the amount of time that you're measuring for a particular compound, or the amount of time that a whole bunch of different measurements are averaged together to get, an average of that time period. Why is that important? Well, the example kind of tells you. So if you're exposed to something that's 100 parts per billion for 15 minutes of an hour, and the rest of that hour you're not exposed to anything, that hourly average is actually 25 ppb. So it smooths those curves down to give you an average over that time period. That's important because, for example, the Bay Area District, most of the stuff that they put out is hourly averages, with some exceptions. Some of the organic compounds are measured over a 24-hour period. The PM is measured over a 24-hour period, things like that. So that gives you some idea of, is it short-term exposure? Is it long-term exposure? How smoothed does that curve get? Next slide, please. I only have 5 minutes, so I'm trying to move through here quick. I also want to make the point that, why do they only measure those few compounds? There's technological limits to what can be measured, right? You can measure a lot of stuff, but a lot of times that has to go to a laboratory. There's a lot of stuff involved with getting those measurements. So technology is actually kind of a roadblock to measuring a lot of different compounds. And again, I'm just kind of letting you know the organic compounds and the PM that's specific PM is typically measured over a 24-hour period. So that really smooths that day down. Next slide, please. What did I say here? Okay, there are other types of monitors besides this big population representation, and we have a number of them located throughout the Bay Area. There are monitoring stations that are designed to be local. BCAMP's monitoring station is an example of that. There's some other examples that are run by the Bay Area, but they're put nearer to like roadways, major industrial sources, things like that, so that you can get an idea of what that population is impacted by. The Air District also requires what's known as ground level monitors, or GLMs, and they're particular to refineries. And these GLMs measure hydrogen sulfide and or SO2. Because that's indicative of a refinery. You get those particular compounds pretty specifically from a refinery. The issue with the ground level monitors is it's one instrument in one location. So you're only sampling in one very specific spot and trying to make that represent a larger area, right? There's also source monitoring that goes on. So the district does require industry to measure stuff at stacks. So the outputs of the stacks are measured, you get that in real time. The problem with those instruments is they typically just measure CO, oxides of nitrogen, and SO2. Difficult to measure organic compounds in that sort of environment and other things, PM, things like that. It's difficult to measure. There's also what's known as source testing. This is where guys go out and jam stuff into stacks and collect the effluent and then bring that to a laboratory. The problem with that is those are just particular snapshots in time of what's actually coming out, right? And you kind of generalize that based on the fact that most industries kind of operate on a steady state basis, and you kind of extrapolate that over time. Next slide, please. Thank you. Okay, so fence line monitoring at refineries. Why did we do that? The main reason was we're able to measure the entire fence line of the refinery. So it isn't a point anymore, it's the entire fence line. We do that by shooting light across that, chemicals across that light, and we're able to read that spectra and determine what kind of compounds are there. We can measure specific organic compounds, such as benzene, toluene, xylene, the BTEX compounds if you're a dork like me, sulfur dioxide, hydrogen sulfide, and ozone. Ozone's kind of a byproduct of it all, but it's important because you can kind of determine how good your quality is by looking at your ozone number and seeing if that matches what's going on in the other areas of the Bay Area. It was intended to provide information to refineries so that they could identify problems that are occurring within the refinery and take action before they become a larger problem. It also lets the community know, hey, what's coming across the fence line right now? I smell something noxious. Can I get some information about that, right? So that you can take some measures to limit your exposure. Maybe you won't go to the park that day or ride a bike. Okay, next slide, please. And this is the last slide, so you won't have to listen to me anymore. I just wanted to give you a brief sort of idea of what happens during, big incidents. And you may have heard that, people do a lot of modeling of air pollution. And I just wanted to give you some real quick background of that. Incident monitoring is extremely difficult. The reason for that is you don't know when it's going to happen. You don't know what's involved. Unfortunately, there's usually fires. So that fire heats up the emissions, puts it up in the air, usually passes all that monitoring that you have located near the refinery and puts it downwind on somebody else. You have no idea what's in it. So it's difficult to, collect and then run the appropriate analysis to find out what's going on in there. So I just wanted to give you that point. Modeling is great because you don't have to spend a lot of money, building stations and putting equipment and all that kind of stuff, but it's limited, right? Again, you're trying to take very large representations and model how that goes on. Think of like forecasting the weather, right? We've become very sophisticated doing that, but it requires a lot of information. There's a lot of variables. You have to know a lot about meteorology. You have to know a lot about flow rates and temperature and chemical composition, just so that you can model that effectively. Modeling's pretty good at the general, but it's really difficult to do in small areas. So that's all I wanted to say. That should give you enough background for the folks who are going to talk later on, talk about exposure and more advanced technologies. So thank you very much for your attention.
Dr. Michael Jerrett. Dr. Jerrett is an internationally recognized expert in geographic information sciences for exposure assessment and spatial epidemiology. That's basically what happens when people get exposed to air pollution and depending on where they live. So he's a professor in the Department of Environmental Health Sciences at the UCLA Fielding School of Public Health and the Jonathan Fielding Chair in Climate Change and Public Health. Dr. Jerrett earned his PhD from the University of Toronto in Canada, and he has a 22-year history of studying health impacts due to environmental exposure, depending on where people live. I'm kind of simplifying it. He's currently leading a health study. I'm sure it's probably multiple health studies, but at least one health study in Southern California, which we'll refer to later. Welcome, Dr. Jerrett.
Okay, so now do you...
So thanks, Don, Gamiles, and Argos, and everyone else for organizing this event. Very timely. Those of us down here have had a good dose of toxic air pollution from the wildfires. are learning firsthand what a prevalent part of our existence it's going to be with climate change and continued reliance on fossil fuels and potential industrial accidents. What I want to do tonight is give you a very high-level overview of the Aliso Canyon Mr. Health Research Study, and then touch on a few results. Don asked me to present this as sort of a model of the kinds of health assessments and exposure assessments you can do after you've had an industrial disaster or natural disaster. I guess we might call it unnatural disaster now with wildfires because humans are playing such a large role. Just for those who maybe aren't familiar with this event, it happened in 2015, 2016. It was the largest single leak of methane ever recorded in U.S. history. The facility is an underground oil field that was depleted. It's actually the John Paul Getty's first oil field. And it has a huge storage capacity, so it's no longer viable for harvesting oil, but it allows for the storage of an enormous amount of natural gas. And there was an uncontrolled fugitive leak because the pipe, which goes to about 8,500 feet underground into the cavern, ruptured at around 1,800 feet, and they were unable to control it. So really, I put 9,000 people evacuated, but I think it's 9,000 households, so it's more like 25,000. And the methane was released, it was the equivalent of all the cars driving in California for a year roughly in terms of its contribution to climate change, so greenhouse gas emissions. But I and other scientists that were working in the field, including Don, Gamiles, and Argos, began to measure air pollutants like benzene, toluene, ethylbenzene, xylene, some particles, and doing indoor sampling. We assisted the LA County Department of Public Health, and we definitely were detecting elevated levels. They weren't always above health standards, but many times greater than what we would normally find in Los Angeles air in the immediate community surrounding the facility, and going as far out as really about 7 or 8 miles. We also found in the homes an unusual cluster of metals, barium, antimony, strontium, manganese, and it really for us indicated that there had been large-scale penetration into the homes from this leak. And what was happening is people were going back to their homes without properly remediating the indoor air pollution that had settled there and getting quite sick as a result. We also saw numerous times where there were oily substances that were blown out of the facility as well, and these deposited on outdoor surfaces like cars, picnic tables, that sort of thing. So, we step back, I think it's fair to say that urban disasters are becoming much more common, the climate crisis, and with our continued reliance on fossil fuels as our main energy source. And it's really important to understand the long-term health implications of these disasters and really of continued reliance on using fossil fuels. And this is a large study, $21 million. It's funded by part of a lawsuit from the state of California against Southern California Gas and Sempra Energy that mandated the execution of a health study, an exposure study. But I think, importantly for your purposes up in the Bay Area, this can be used as a means of modeling how you deal with other disasters like refinery leaks, for example, wildfires.
What happened? Oh.
So our broader research questions were whether or not exposures from this Aliso Canyon disaster affected people's health adversely in the past or in the present. whether the ongoing emissions from the facility are adversely affecting people's health, and whether we can link health outcomes to specific exposures from the facility. When we look at the environmental exposures, we're really trying to assess, and thanks Eric for that nice lead in, the composition and the amount of emissions released. And we want to examine how the emissions travel through the air, and importantly, we want to know where they landed and who may have been exposed. So we've got several sub-studies for the exposure assessment. We're using remote sensing satellite imagery to try to get a more precise understanding of the impact zone from this study. And we're building that into and working with Dr. Mike Kleeman at UC Davis to develop what's known as a chemical transport model of methane and air toxins, so we can characterize the exposures that occurred during the disaster event, but also for routine operations of the facility. We also have analysis of raw natural gas that's going into people's houses to see whether we can better understand the composition of the gas. Remarkably, this compositional analysis is not something that the gas company is required to report. So we really need to know what's in the gas so that we can do a better job monitoring that. We're in our final stage of conducting indoor and outdoor air monitoring for speciated particles, meaning that we're looking at the chemical and composition of the particles, and for volatile organic compounds. And Dr. Tom McCone at UC Berkeley is leading a quantitative risk assessment that looks at all cancer and non-cancer outcomes and how those could be related to exposures from the facility and whether or not it's elevating people's risks. We have a wide array of health studies that are ongoing, and I'll just break these into existing data and newly collected data. So our first emphasis has been on children's health, looking at adverse pregnancy and birth outcomes like low birth weight babies, preterm birth. But we're also ordering and just waiting for the state to deliver neonatal blood spots. So every baby born in California gets a heel stick taken from their heel that then, sorry, I don't know what's going on with my computer. And then that is stored. So we can do very complex analyses on that with what's known as metabolomics. So we work with Dean Jones's lab at Emory University, and they can literally pull 10,000 different molecules out of one of these little spots of blood. So we can look at abnormalities before, during, and after the blowout event, which is really important to be able to look at these things as they occur temporally and spatially. We're doing analyses on cancer registry data, on healthcare utilization, and we're also using the California Health Interview Survey data to assess whether or not the blowout was related to a wide array of health outcomes. And then we're doing new collections of data. So we have a survey that is being done on 2,400 people, about 1,800 in the affected area and 600 for control locations, and I'll talk a little bit more about that. And then we're doing a sub-study on 600 people, which will include a clinical exam that's being led by Dr. Wendy Robbins of our nursing school, and a biomarker study. So we'll be extracting or sampling blood and urine from the participants and having them do lung function tests. So one of the big questions is, who was impacted by this event and who is experiencing ongoing exposures during, before, during, and after. And here, we want to be as specific as we can to characterize that impact. But we also have to concern ourselves with sample size. So if we don't have enough people in the impact zone, we can't really conduct quantitative spatial epidemiology. So there's a bit of a tension there. But smaller areas could lead to very small sample sizes and data that's too small to discern differences between the affected area and other comparison communities. So to characterize this, we're using those methods I mentioned, the satellite imagery, chemical transport modeling, reports of health concerns from residents, and our initial analyses on birth outcomes. This just shows 4 different satellite retrievals that are available, and this is really, an important source of information. It has its limitations because all we can see from space is the total column. In this case, we're looking at methane as a sort of sentinel marker of the potential toxics. But it does give us an idea about how far away the impacts were stretching, and on this day it was about 8 kilometers. We do see influences going out to 18 kilometers, but it is somewhat concentrated in that first 10 kilometers. And then we would take, the health data and in that area and demographically match it to control areas. So based on these demographic, socioeconomic, environmental, and health conditions. And here we have 2 sets of controls where we're recruiting that survey data and all the people that go in the clinical exam. Here's our impact zone. These are just the zip codes. And we found very good matches not far away in the Simi Valley. This looks like it's right beside the impact zone, but there's a mountain range between it. So it is insulated. We don't see any impact from the blowout on these communities, but they are demographically and environmentally very similar otherwise. And then we have a much broader selection of control areas that we can use for administrative data like the cancer registry and the administrative healthcare utilization data that's available everywhere and is relatively less expensive to work with. I just want to give you a quick look at what this means when we start getting into the epidemiology. And this was where they're looking at women exposed to the disaster in the impact zone have more adverse birth outcomes than expected. And this has really been a major advent in spatial epidemiology, is this idea of quasi-experimental design. So just like if we were trying to test the efficacy of a drug where we would give some people the drug itself and other people would receive a placebo pill and they wouldn't know, what we try to do is to always have a control group that is demographically matched, that's outside of the impact zone, so we can make certain assumptions about what we might see in their health patterns in the absence of the disaster. So here we're able to characterize the birth outcomes before, during, and after the blowout, and we use a statistical method known as difference in difference modeling. I'll show you more about that. We looked at low birth weight and preterm birth based on California's birth records. So this is just how these quasi-experimental designs work. So we may have a period before the disaster. There could be some places that have higher prevalence of adverse birth outcomes for a variety of reasons, but they generally track in what are known as parallel trends. And this is the outcome that we would observe following the blowout in control areas. And here's what we might expect if there was no impact of the disaster. But what we're hypothesizing is, as we move through this, that we're going to see these outcomes become elevated roughly during the period of the disaster and in the impact zone. And then it would come down and closely match what it would have been otherwise without the disaster. So this is our estimated effect from the disaster, and because we're simulating what would have happened in the absence of that disaster, if we see deviations that are large, we can detect those statistically. So for this, we characterize different periods of the woman's pregnancy, so third, second, and first trimester, and you can see just here where they overlap with the disaster. We end up with quite a large sample, something like 30,000 women that within the impact zone had babies in that period. And then this red line is our control communities. And what we can see here You can see that little dashed line is what we would have expected, but we see this big spike in low birth weight babies. So it was more than 50% higher than what we would expect, and significantly different than what we would have expected without the disaster. And this is relative to all of LA County, but we tried it with many different control groups, and that really persists. And what we also see is that as we go farther away from the site, the odds of having low birth weight babies go down. So beyond 15 kilometers, we don't see anything. At 10 to 15, we see this slight elevation at the time we're within 5 kilometers, about 3.5 miles of the facility. We get this more than 60% increase. So it shows us that there's something going on that's likely related to the facility, because we have this graded, what epidemiologists call dose response function. So I think this study could serve as a model for understanding exposures and health impacts of a major industrial disaster or other disasters like wildfires. And it can be used to examine a wide array of different health outcomes. And we're currently extending this to better understand the impacts of the wildfires in LA. And this is a really good article. It was written by a smart New York Times reporter, Rich, on the disaster for anybody that's interested. And I just want to thank you for your time this evening and thank all of my collaborators.
Now we want to move on to how are these pollutants measured today. I'll give you a hint, not well. Our friend Maureen Brennan will talk about her experience in Rodeo. Maureen is a clinical lab scientist of 50 years. She's a member of the Fence Line working group with Phillips 66 and also a member of the Hazardous Materials Commission for Contra Costa County.
This is amazing to be a part of this group. I'm learning things in real time, just as you are, and it's wonderful. So anyway, I moved to Rodeo 24 years ago. I live a little over a mile from the Phillips 66 refinery. I looked at the refinery and thought, doesn't look so bad. It's not belching and spitting black smoke. There it looks pretty good. Then I started looking into what the emissions are. And most of the gases coming out of these refineries are clear, colorless, and odorless. We don't know how we are being poisoned. Public health looks at a few parameters like asthma rates, cancer rates, low birth weights, which, by the way, Rodeo is in the 95th percentile for asthma. That's very high. There are also other long-term health problems such as autoimmune diseases. These diseases are chronic, typically untreatable, and expensive to manage. Next slide, please. So air monitoring is very important. These facilities are considered Title V facilities under the Federal Clean Air Act. These chemicals are dangerous to public health. Those of us who live near the fence line of the refinery are under constant threat of explosion and or fire. It is not a safe industry, no matter how workers try to make it seem otherwise. We in the local communities can't live our lives feeling constantly afraid. And that's why air monitoring is important. We need to know what's in the air. At what levels? Is it killing us? Is it killing the planet? Is there a leak pending explosion? We need to know. Next slide, please. Oh, Don, you're doing good. So there's a variety of ways of monitoring in the Bay Area. Our front line is the Bay Area Air District. It's the agency we rely on the most. It sets policies regarding air pollutants and hopefully enforces it through 9 Bay Area counties. There are 3 facilities in the Northeast Bay along the Carquinez corridor. One in Concord, one in San Pablo, and one in South Vallejo. There's also a monitor for H2S only in Rodeo near the refinery. The daily measurements give an ambient background measure of air quality, but it's not going to indicate a particular problem at a particular facility. Next slide, please. There's lots of different chemicals that are released at refineries. I just wanted to give you a brief show in my little pie chart there. A lot of ammonia, you can see propylene, xylene, toluene, all those big chemistry lesson. Phillips 66 is the biggest emitter of any of the refineries in the Bay Area, and Valero is second. And next slide, please. This is just Phillips 66 in particular. This is Cal EPA statistics. And I want you to just look at the ammonia there. It's NH3, it's sort of in the middle of the column. That's a high amount, 138,000 pounds per year. It amazes me that this is always listed as not detected on our monthly reports for the Fence Line Committee. Next slide, please. Then there's the next level of monitoring is the fence line monitoring at the individual refineries. P66 uses a company called Sonoma Tech, as does Chevron and Valero. MRC Martinez uses Argos Scientific. Also, Benicia, God bless them, built a system of its own. The Benicia Community Air Monitoring Program, or BCAMP, they are independent. The other two are not. They are connected to the refineries. Rodeo is not happy with Sonoma Tech. We feel we cannot rely on the accuracy and precision of their data. So an example of that is ozone monitoring excuse me. So a rep came to us from BCAMP and pointed out that to our fence line working group that the ozone levels, according to this company, Sonoma Tech, were at 0. Well, no place in the Bay Area is 0. That's impossible. So they, God bless them, offered to loan us their ozone monitor. I know this because I installed it on my own roof in Rodeo. And suddenly, Sonoma Tech started registering ozone levels of 30 on its fence line. But this was still suspicious. It is known among scientists. Let's take a look at the next slide. Next slide, please. Here's, after they, decided that it was 30, we were measuring at 30, but it was a flat line. And that was suspicious because that's not how ozone works. Ozone typically goes up during the day as the Earth heats up, and then it goes down at nightfall when the Earth cools down. That is not appropriate, what the data that we were receiving. So next slide, please. So this is a comparison of the readings. Backmud has a good reading. It goes up and it goes down, just like it should. BCAMP was showing the same thing. That's the ozone monitor on top of my house. But look at what Sonoma Tech was telling us. It was down around 0.1, it barely goes up and mostly is flatlined. We don't trust the data, is my point. Another example of why we don't trust the data, next slide, please, is these are the reports where we get from the Fence Line Committee. They are monthlies, excuse me. And I just want to point out where it says invalid, there's 9,180 readings that are nonsensical data, invalid. That's a lot. Now, that's out of 1 million readings. That's quite a bit. But that, as a scientist, is a little bit offensive. Also, look at the final column where it says OSE. This is how the percentage of the time that the monitors should be operational. By contract, they promise us that they'll be operational 95% of the time or greater. Well, every month, there's like 2 to 3 different numbers that are below 95%. And if you look at the column right next to it, 62%? Yikes. These are not good numbers. And anyway, so there's a lot of misreads that we have to pay attention to. And unfortunately, what we see happening is this same data that you're seeing is received by Backmud, or bad air. Yet, I don't see particular analysis of these numbers. They receive the reports and nothing happens. Okay, next slide, please. I would like to throw in a new technology of concern called carbon capture and sequestration. This will bring new challenges of leak detection in our pipelines. And just so you know, because here we are in Benicia, the Benicia City Council is proposing a moratorium on CCS pipelines and drilling. and until further studies. And we encourage you to support this with your community council people. This next slide I want to show you, well, let's talk a little bit about a specific chemical, benzene. Benzene's a bad boy. Very low levels, it causes health harm. The level detected in this month was oops, go back one slide, please. There we go. Was 2.0. But what my concern here is that the community warning system level 2 is way too high. If we're having health harms at 2.0, but no one blinks an eye until it's up above 1,000. That's way too high. The levels on many, many of these chemicals, you can see 10,000. Hydrogen sulfide is interesting because it's 30, yet the detectors that are typically used can only detect down to 25. That's a very small margin. And so there's a lot of room for error in this. So the next slide, please. In regards to benzene, just so you can see, fence line monitoring usually detects down to 5. If it's less than 5, it typically says ND, or not detected. But look at what the health limit is. It's 1. So no matter how much benzene we're getting, we'll never know because it's still harming us at a level of 1 when it can only be detected at 5. Either way, the technology is not protecting us. And don't let me get started on the monitoring of H2S. 32 neighbors in Martinez called in concerns of a rotten egg smell before the big explosion and the 4-day fire that we all know, February 1st, I guess it was. H2S is a neurotoxin. It's similar to lead. It causes brain damage, among other things. This should be really looked at by the people who are in charge. Next slide. I need to mention that the Bay Area Air District promised the fence line communities independent air monitoring back in 2018. Nothing has been done. Martinez Refinery has had 2 bad accidents and 21 significant releases in the past 3 years. Benicia has an independent community system only because they have a dedicated group of local people who bought the systems themselves and through fees and penalties from Valero. Their data is sound because it is independently funded. There are new technologies on the horizon that could help all of us. I'm very excited to be here tonight and to hear more about the concept of optical tinting. I believe it's the future. It actually measures levels of toxic chemicals inside the refinery before it drifts over the fence line into our communities. And this last slide, I have to put up a picture of my bunnies. Because it's not just about you and me and people in this room and your community. It's kids and our pets and everything. We are all affected. We all deserve to be safe. So thank you all for coming out tonight. This is Marilyn Bardet, and we love her. And she's been a mover and shaker in this community for a long time, and is one of the founding members for the Community Air Monitoring Project.
For BCAMP.
That's
She is
just a small
passionate
bio.
advocate for healthy air, healthy environment.
Thank you, Dave. I want to say, too, as my own way of giving myself cutting some slack, I'm an artist, and I came to Benicia not knowing a darn thing about the refinery, but it was well into about 10 years into my time here that Valero bought the refinery from Exxon, and I had to start paying attention. And it's only because I'm Susie Q. Public and I ask a lot of questions that I've learned as much as I know today, and I'm still asking questions. But one of the things that I'm going to talk about is the structure of how the regulatory environment as related to Rule 15 and these fence line systems and the problems we're encountering. So I want to sort of set you up for understanding how to understand it. Okay, and I don't have slides. I don't do that. So you're stuck. As you heard from Eric, Regulation 2012 Rule 15 was adopted by the Air District in 2016. That's 9 years ago. And here's what the rule was meant to do. Rule 15 required that each Bay Area refinery devise a fence line monitoring plan to install what we call open path light beam type systems that are air monitoring equipment that can be placed along the fence lines at refineries. The intention was that these systems would detect fugitive toxic gases at very low concentrations that daily escape from processing units and travel beyond the boundaries of the facility and may impact human health. These fence line systems detections, when tracked using wind measurements, could help refineries locate the sources of the leaks and thus save product and possibly prevent other more dangerous releases. The fence line systems were meant to protect the community. Real-time monitoring equipment, when effective and performing correctly, can serve as an early warning system for the community, giving people accurate information 24/7 of the various types of toxic gases emitted at refineries. In this way, at 5 to 10 minute intervals of detection, which these systems can do, you can detect spikes in detection. So compared to what Eric said about averaging over an 8-hour period, where we call that blenderized accounting of the toxins in the air. So you may not feel when you read a statistic that's an average that you're not being impacted, but on a daily basis, over many years of chronic exposures at very low levels where you can then achieve a spike occasionally that you're not aware of if you're not able to acquire that kind of information from these systems, you don't know what you're getting. Okay, and you already heard Eric talk about signature gases that include very highly toxic benzene that the state of California regulates, toluene, xylene, and those are the gases that are called BTEX. So these open pass systems, one of the kinds of systems around the perimeter of the refinery is monitoring for BTEX. The other system, open pass system, is monitoring for hydrogen sulfide gas. That's very important. And it has to have its own separate instrument. It is not part of the BTEX group. Okay. Are you okay? Okay, here's where things get tricky. Rule 15 required that each refinery submit a data quality assurance plan. That's a big, catch that, data quality assurance plan. We call it a QAP. But just think data quality, data control, right? That demonstrates methods by which the data produced could be assured to be reliably accurate and show detection capability at the lowest possible detection levels. To date, since the fence line systems at each refinery were installed, the district, I'm sorry to say, has not given final approval of the quality assurance plans that have been submitted to them, even after allowing more than 1.5 years for refineries to resubmit corrected quality assurance plans. To date, there has been no enforcement action taken by the district to force refineries to be in compliance with Rule 15's requirement for quality assurance. And it doesn't stop there. The problem is we cannot trust the data. And I'm going to tell you why. First reason, the quality assurance plans have not been approved, final approval. Therefore, there's no method of verifying the accuracy of the system by the refinery that is trusting its contractor to monitor every day. Operationally, the contractor is in charge, but the refinery, the buck stops with the refinery who hired the contractor. And Maureen has talked about Sonoma Tech. Valero is also contracted with Sonoma Tech, and I commented on our plan for this refinery in 2017 and had questions then. And I knew there was no quality assurance plan that had been approved. And I go to the CAP meetings and I hear how the refinery discusses this, and, you know, it's put in nice terms about how they're getting to it. They're working on it. Okay, here's the second reason. Under Rule 15, refineries are allowed to submit their data up to 90 days after the date the raw data was collected at the fence line in real time. That means you got the real data, you got the raw data, you got it. But the refinery, the air districts, doesn't yet have a way to get that data directly to them in real time via the internet. I mean, this is possible, right? Instead, the refineries have 90 days to submit a tranche of data, sets of data, let's say for 6 weeks. 6 weeks of data. They have 90 days to what I call adjust or fudge the statistics so that they can make it seem that where they've got anomalies and problems and downtime with certain equipment, et cetera, that they can meet, they want to show the district that they have met the standards, performance standards for Rule 15. So, do you get my point? What happens when the district receives these tranches, data sets from all 5 refineries? What do they do with the data? Well, first they store it. And they report it selectively to the public on the district website. And they allow the public, like me, I've done this several times, allows the public to make a special public records request to obtain the data. But what purpose can requesting the data serve? Ideally, accurate data can serve to support accurate health studies and medical research. It can tell the public over time what the performance level of these systems have achieved at each refinery. However, here's the big sticking point. We have learned, and I consider this one when I realized this, and it took me a long time to realize this. We have learned that the Air District does not assess, evaluate, or verify that the data submitted is accurate for any of the refineries. This I consider an outstanding regulatory failure from the public's point of view. But, you see, they've requested those quality assurance plans that they can't approve. Therefore, the refinery can't guarantee the data to be correct. They can play around with this problem of the district's inability there. And so they can submit data that's not accurate. And then because it's not verified independently at the district, and then that is what we get to see, even in a data public records request. There's no accuracy there. We can't trust the data. And I'm not making that up. And Maureen has given several examples, and there are many more. We've learned from reviewing fence line data submitted by Chevron, P66, Marathon, and Valero that they're getting away with operating their systems at much less than the 90% performance operational uptime that is required by Rule 15. In other words, you go on Valero's website for their monitoring data, and you'll find often that the instruments are offline. And there are only a few ways in which they can be offline and be excused of being fined for that. In other words, if the weather is bad, and what was the other one? I'll just give you that example, but for instance, maintenance is not a reason to have these machines down for as long as they are, because you should have 90% completeness in these performance of these machines. So what's the use of these systems right now? I won't go into detail, but at Valero, the hydrogen sulfide system hasn't been working since 2019 when it was installed, and Sonoma Tech is our vendor. So that's 6 years out of compliance, and the district has not yet enforced the rule with Valero. And just because we're about to consider voting for an industrial safety ordinance in Benicia, suddenly Valero is saying, oh, I think we're going to put in the fourth fence line finally that we've been all waiting for that faces Southampton neighborhoods. And what's the problem there? They're going to use this, I'm just guessing, use the same contractor and the same equipment. Why would they go through that if we cannot say that we have reliable data coming from not only the system itself, but the operator, the contractor? Can't trust Sonoma Tech. And I know it's not polite to talk about company names, but after all these years, it's not fair. I wrote to Sonoma Tech in 2017 talking about their plan. I submitted 25 pages of commentary on this, so I feel entitled to speak their name. I can't take the time to explain why MRC Refinery's contractor, Argos Scientific, has been doing such a great job producing accurate data and reliable performance values that meet all Rule 15 criteria. It's a wonderful, inspiring story. Ask me about that fact later. But back to the point. It appears that the Air District has no incentive right now to correct these structural problems that subvert the very meaning and usefulness to the public of their own policy, Rule 15. But, okay, so I gave you all the bad news. Here's the good news. We work well with the district. We feel they work for us. We want to help them do a better job. And so here are some things that need fixing. The weaknesses of Rule 15 must be fixed. The district must enforce refineries' compliance with Rule 15 and assign fines every day that there has been no quality assurance plan that meets the requirements to prove data accuracy and reliable equipment performance. The district must develop the staff and the means to evaluate and vet data collected and submitted by the refineries for accuracy. The solution, however, must be to require refineries to report all raw data as soon as it's being collected at the fence line systems. Send it by internet to the district. What's the problem with that? And I'm going to quote Kathy Carriage from a community perspective of health and safety. As she always says, bad data is worse than no data. Bad data must not be used for doing community health risk assessments. And guess what? The state is thinking about allowing refineries to use their data and do the health risk assessments. This is a big fat no-no. So that's, I'll be speaking later about a vision for the future that is very positive.
So our next speaker is the Chief of the Benicia Fire Department, Josh Chadwick. Josh started his fire service career at the Benicia Fire Department in July of 1998. During his tenure, he worked his way up through the ranks and was promoted to fire chief in March of 2018. He has a bachelor's degree in fire administration and a master's degree in emergency services management. And Josh was part of a 3-person city team to develop language for Benicia's pending industrial safety ordinance, which we are hoping will be approved by the council in March. A key aspect of the plan is a consolidated air monitoring website that will include all of the monitoring stations in the city. He'll describe the attributes and benefits of a single site and how it can improve emergency response.
Specifically, what I was asked to talk about, in quotes, is the advantage of an integrated air monitoring website for first responders and how it can improve emergency response. So that's what you're going to hear about. So why would an integrated monitoring website help us? First, you got to think about the mindset from first responders and from firefighters. We understand that there's air monitors all over the community that you guys have been talking about are of great concern from a chronic standpoint. But for us, we're more concerned about the acute readings that we get on these monitors. So we see the acute readings, from releases or fires or explosions. That's what we're most concerned about. We care deeply about the air pollution in our community and what happens, but we have other people that are far smarter than us that do the studies and understand that. So what you're going to hear me focusing on is the acute effects of what we're seeing on the air monitors. So real quick history. Air monitors have been in the fire service for quite a while. Going way back, they're an essential part of our operations. A lot of people talk about our fire engines rolling down the street. Those are like a toolbox, and there's lots of tools in there, and one of those tools are air monitors. Specifically for the Benicia Fire Department, we began using air monitors 25 years ago. I remember I was a relatively new firefighter when they rolled it out, and we got our training in our first air monitors. The reason we got those was for confined space entry rescue. There were started to be lots of incidents throughout the area and really throughout the nation where industrial workers would go into a confined space, a vault or a tank, and they would collapse or get injured or for whatever reason need to be rescued. The fire department would arrive on scene, firefighters would go into the space, and next thing you know, they become a victim. And it's because they're, the reason that they thought maybe the person was having a heart attack or fell or got hurt like that, but the reason was they were, breathing something toxic in the air, or possibly there wasn't enough oxygen. So we got the monitors really for confined space originally. And ultimately, it was for firefighter safety. Our original monitors were 4-gas monitors. They measured oxygen, a lower explosive limit, hydrogen sulfide, and carbon monoxide. Over a while, we were using those for confined space, and we started using monitors for other things. Again, more so for the firefighters. We realized that we would put out a house fire. We wear our self-contained breathing apparatus. We'd attack the fire. The fire's out. Now we've got about an hour to 2 hours of overhaul, cleaning up, picking up the debris, and we took our masks off and we're sitting there breathing all that. And what started to realize is that there's a tremendous amount of hydrogen cyanide in that space. So we got a hydrogen cyanide monitor. People started getting CO monitors in their households. You always have a smoke alarm, but then the carbon monoxide monitors started becoming popular. We would get calls, my carbon monoxide alarm's going off. Well, so we had to get carbon monoxide monitors to see if it was a false alarm or if it was a real reading. Later, we started going on calls, and we ended up getting, currently the crews on their medical bags carry a little tiny CO monitor. We'll go on a call, somebody would be complaining of a headache, maybe a little bit of shortness of breath or dizziness, and then all of a sudden our alarm starts going off. They're on all the time, 24/7. They have a little tiny battery that stays, and you don't need to replace it very often at all. And before used to thought, we just transport to a hospital with a headache or dizziness. Now we realize, well, that was from a CO leak in their house. We also started getting particulate monitors, and that was really, part of that had to do with the wildfires. You talked earlier about the wildfires down south, but we were having wildfires, for quite a few summers now, where you guys remember the entire community. It could be 100 miles away, but our community was inundated with smoke, so we had those monitors. And then we started, with all of that, we started using it for response for odor complaints. So we would get a simple, a resident would call and say, I have a strange odor in my house or outside my neighborhood, and we would get there. And sometimes it would be a false alarm. I'll tell you, there's probably half the time it's a skunk, and you get there and you know right away it's a skunk. But there are other times where it's something else, and so now our monitors help us, with detecting what all is going on and if the air is safe or not. When there's really an incident going on, what we've noticed is it's generally not one person calling. We'll get a call, and then a minute later, dispatch sends us on another call, and then a couple of minutes later, we get another one, and we start seeing a pattern where you're getting multiple people complaining of a smell in a neighborhood, and that's when we start going out, and that's when it's not usually a skunk. It's usually something something else, and so that's where we start looking at the possibility of looking at these websites. So, when we're on scene with one call, we're not going to pull up Valero's fence line website or BCAMP's fence line website. But when we start getting multiple calls, that's something where the incident commander can look back and pull up some websites and take a look and see if there's a pattern going on, or, very rudimentary modeling of what's going on with the smell, and what we're seeing on those monitors. The problem is, it's difficult right now. I mean, really, you have the Valero fence line monitor. I know there's some skepticism about the quality of that. And then you have the BCAMP monitor, which you'd have to go to another website, and it's reported differently. And it's not really easy to use in the field. The process takes time, and it's really kind of taken away from our emergency response. So we have a vision, and currently, what we would like to do is take all of the monitors that we currently have, and including BAD recently installed one in town as well. So now there's 3 really, potentially good sources for air monitoring, to be captured on a website. But our vision is to start employing or deploying monitors throughout the community. We're looking at not just around the fence line or not just around a single source, but all throughout the community. We're looking at possibly partnering with the school district and maybe putting them at the schools to start with. And maybe they aren't going to be quite as robust as the BCAMP monitor, but something that's going to be significant and it's going to be able to get a lot of the information that we want. And we have this vision of being able to have those monitors all feed into one site. And for that would be helpful for emergency response. I already know it's going to be helpful for the community. The community, there's a lot of people that want that. But before we don't really use that a lot. But if we had something where they were all together on one spot, we could go to one place and look at it and really get a good picture of what's going on. I think that would be very valuable to the community. The last thing I want to touch on is notifications. So another problem that we have is if there's a release, wherever it is, and it's at 3 a.m. and everyone's sleeping and nobody's sitting there with the screen watching their monitors, it's not going to do a whole lot of good. Unless somebody gets out and smells it and calls us, there's a good chance that we're not going to know what's going on. My ultimate vision would be, once we have all these monitors combined into one site, if we could create if there was technology that could create a trigger point where, if whatever level of whatever if it's hydrogen sulfide, if we pick a level where if it spikes and you get a hydrogen sulfide spike, or maybe 2 in 5 minutes or something along those lines, it would send out a notification. We would be notified at the fire department, and potentially the community could sign up for those notifications and see that as well. So that's ultimately where I want to get. I know we have a lot of work to get there, but I see us being able to do that, and that's what I'm hoping for. And that's it.
Our next guest will explain how we can accurately measure airborne emissions coming from industrial sites. And our guest is Professor Jochen Stutz in the Department of Atmospheric and Oceanic Sciences at UCLA. His group works on the development of spectroscopic remote sensing instruments to measure atmospheric trace gases and its application to studying atmospheric chemistry. He has led the installation of state-of-the-art air monitoring equipment at refineries that can provide early warning to the public of hazardous releases.
So what I'm going to tell you about is kind of the next generation of monitoring. And this was a project that is funded by the South Coast AQMD, and it was really intended as a technology demonstration project. But we learned a lot of things about refineries and how these systems can be used to even help refineries to manage their equipment. And so we refer to this as the optical tent. So just the motivation, and a lot of this was already touched on. Let me see, let's change my slide. Here we go. Has already touched on earlier. I mean, the premise that we had with this optical tent was that the measurements, not just around the fence line, but also inside a refinery, is much better suited to identify releases of benzene, toluene, ethylbenzene, xylenes, or BTECs. And modern remote sensing techniques can really do this. And the idea of a tent was the original one, and that graph actually was from the original proposal. You'll see it doesn't look exactly like that, but it does the same thing. And so for me, one of the main ideas was if a facility can identify a problem faster, they can fix it faster, and therefore avoid accidents, reduce emissions overall, generally also protect neighbors, etc. So being inside a refinery has a lot of advantages. It does help, actually, and I'll show you an example at refinery operators to know what's going on in their facility. And the other thing that the project was really about to show that this can be done, and it can be done with a reasonable amount of work, and I think I pretty certainly can do this. Basically, what we're doing is the same thing that Commercial Instruments doing, just we're doing a little bit better and fancier. So we call these research-grade instruments. They're slightly more expensive than commercial instruments, but they work the same way. We use light-emitting diodes and not lamps. A bunch of advantages I don't want to talk about. We send the light through the atmosphere, hit a bunch of reflectors that are hung inside and along the fence line of the refinery, and then we have this scanning telescope. You see that little movie changing to different reflectors, and it basically constantly changes reflectors, and therefore we can set these systems up in a way that basically scans over the entire facility. And this is the actual setup in a refinery down here in Los Angeles, and we have two of these instruments at the corners, and then reflectors on the fence lines and inside the refineries. The reflectors are easy to install. They don't have any electricity, so the refinery actually didn't care if we put them up there, just glass and metal, so that was all pretty easy to do. And then we scan over these light paths continuously. A scan takes about 30 minutes right now. That's basically our initial design. Can be done faster, but I mean, we were learning while we were doing this. So we have these two instruments. We have 5 reflectors per instrument, so about 10 light paths, and cover not everything, but this refinery is a little bit difficult. It's actually on a hillside, so it was very hard sometimes to figure out what to put the reflectors. And so the distances, just to give you an idea, are somewhere between 400 to 800, 900 meters. That's about what we do, and that also gives us really good sensitivity. So aside from doing the scanning approach, we also use a somewhat different approach than a lot of the systems you see. So we actually, we don't calibrate our instruments. We do everything by math. We take traceable literature cross-sections, so the constants that describe how these trace gases impact light, and then we simulate them in a computer, and then we do a data analysis of the spectral emitter. And you see an example here of the top level here, and I hope you can see my pointer, is basically what we see in the atmosphere. We can see ozone very nicely, and then you see these, you can see the red curve is what the theory says, and the black curve is what our algorithm says, and you can see they agree really well. When we see something like that, we're really happy because we're convinced what we're seeing is true. And we have an algorithm that actually does that for us, but we still check by hand from time to time. And it gives us the mixing ratios, but it also gives us per data point an error. And that's really important for us because that's our quality control for every single measurement. We can determine by the error whether the measurement worked or not. We have a couple of other checks. We check whether there's oxygen absorptions in this, and we know how much oxygen should be in the atmosphere, so we can check whether the measurement works. We have these quality checks. And basically, we identify these different gases by a specific way they change UV light. So with that, we basically implemented a real-time data system where the data is saved online, and then we have computers at UCLA that do these data retrievals. We actually put them on a web display. That one is not public. It has the internal paths that are not public. The fence line paths, the exterior ones, are public. So those get sent to a public website, and then we have a web display that we can look at, the refinery can look at, and South Coast AQMD can look at. And actually, the refinery has this thing open now all the time. They just keep always an eye on it. And then we have some algorithms that can send alarms out. For example, for benzene, if it's above 8 ppb in an hourly average, there's a public alarm being sent out. And so just from a technology perspective, we've been doing this now for 4.5 years. The data completeness is over 99%. It's rare that I mean, sometimes our LEDs break. That's the main thing that happens, and then we need to change them. They're usually changed within 10 hours or something like that. We change them regularly every 2 months or so, but sometimes they break without us knowing. Otherwise, it's running fully automatically and just giving us data. There's 6-week periods where we don't touch the instrument at all. We just look at the data. What you see here is basically 4.5 years of data inside and at the fence line of a refinery. And you see that there's releases. There's quite high. I mean, 200 ppb of toluene is not bad. But it's very sporadic. I mean, we don't get like permanent emissions. We have sometimes weeks where there's nothing. But then suddenly something happens. Detection limits, so we're a little bit more careful with the public alerts because we don't want to get false alerts, but they're all below ppb. And I'll show you some examples of that. And I'm going to show you some examples of what you can see with this because it's kind of fun. So the first thing is, this is the real-time website. This was an event relatively early on after we deployed this in 2020. And so our display has a little map. Green means we don't see anything. Red means it's above a certain threshold we put in. And that basically means there is high VTEC somewhere. It's maybe a little bit hard to see, at least on my screen here. You can see that this light path here and this light path here had pretty high values. It's these 2 data points. This was actually a tank leaking here. And the reason why you only see 1 data point is because the refinery had it fixed after half an hour. So it's kind of, we are kind of don't see high levels very often because typically it gets fixed, and I'll show that later as well. And so this is a real-time website, and this is just kind of how these data points look like. And the blue curve is the retrieval, the red curve is what we call the reference, the pure trace gas, and we're pretty certain this is correct. Here is one of, I think, our favorite moments that was relatively early on, and I have to actually mention that Dawn was a contractor at that. And Argos were contractors at the refinery for the first 2 years, 3 years, I don't remember. And so we worked very closely together. And this was actually, we told the refinery that something weird was going on at one of their tanks, or this tank region up here. And they really kind of didn't believe us at this point. We were all very new. They didn't really trust us much. And sure enough, the next day the public alerts came, and it was a tank roof failure in one of their tanks. Yeah. And it took, I don't know, close to like 3 weeks, 2-3 weeks until this actually subsided. And you can see these very high values, 80 ppb of benzene inside the refinery, over 150, I think I cut this off, 200 ppb of toluene. So very, very high levels and sustained for many days. So this was kind of our probably one of the bigger events we saw. One of the things that we've learned from the setup is that if you have these multiple light paths, you have a much higher chance to see accidental releases. And this may be a little bit hard to see because of the color, but this is 2 curves. So these are 2 neighboring light paths. It's this one, number 4 and number 5. And you can see that some of these light paths, especially the one at the fence line, it sees it, it doesn't, it sees it, it doesn't. And that's just the local winds. They just blow the blue into that light path, or they blow it in a different direction. So if you have multiple light paths, you increase your chances. And if you look at that data without the light path, you see that we permanently see something. So it really helps with this detection inside the refinery. What we found from the statistics of detects in the refinery is that the internal path catch, in this case, benzene above 2 pp about 6 times as often as the fence line. So we see a lot more releases when we look inside the or high VTECs inside the refinery than we just look at the fence line. I can only speculate why that is, but the statistics here are pretty clear that there's a much higher chance of seeing high levels of VTECs if you look inside the refinery. What really works well is we don't actually get very long VTECs detects anymore, and what usually happens is, this is an example, so this is about 8 o'clock. This is this light path here on the tank farm. You see benzene going up to about 9, 10 ppb. It stays up, and then you can see here around 6:30ish, something like that, it suddenly drops and goes away. That's when the morning shift came in and fixed the problem. So many cases, these events don't last longer than 10, 12 hours because then they fix it, sometimes even faster. And it's amazing, refinery operators usually know what the problem is. When you tell them there is a problem, they're very fast. Not always. So, for example, how much the refinery actually trusts this system at this point. So we had this a tropical storm in summer in LA, very unusual, and it rained about a foot in 24 hours. So the refinery was flooded with water, and the refinery has to clean the water. The wastewater before it can go back to the sewage. So they actually have a system to strip water out of hydrocarbons, and that system was leaking, and it was emitting lots of benzene. And so the refinery actually asked us to park our instrument on the fence line, and then they turned their wastewater treatment on. They watched the system, saw that benzene was going up, and then they stopped, ran it, and when it went above about 4 ppb, they turned it off so they wouldn't reach an exceedance. So what you see here, these spikes of a few ppb of benzene, is basically the refinery tweaking up the wastewater treatment, and then when it got too high, they turned it down again, and they kept doing this for about 3 weeks until they had their all their wastewater cleaned. So it was not monitoring at this point anymore. They basically use it for process control. So, and they basically watched our website and regulated it according to the website. So at this point, I'd say one of the successes is actually that the refinery is actually using the system beyond of what we actually had imagined they would do it, but they trust it, and the second we detect something inside that refinery, they go out and fix it. And I think that is probably the best way of avoiding high exposure of benzene, if these refineries actually use modern technology to leak check their systems. And it's just the website they look at. So just to summarize this, so the first success of this project, really, we can do this for a long time with very little work. We have very little maintenance. We don't calibrate, so we don't need to spend time on this. You change light sources every 2 months. It takes about an hour. So it's pretty robust. We do see, even in this refinery, which is probably one of the cleanest around, if we think about benzene levels above 2 pp, about 6% of the time we see benzene above 2 pp in this refinery. We see it about 6 times more frequently inside the refinery than at the fence line, so it really increases the ability to monitor BTEX. And unsurprisingly, the highest levels are typically over the tank farm. But I think what really, for us, is very gratifying to see is that the refinery basically is using this now as a tool to monitor the refinery and using it to kind of releases, their BTEX releases, and fixing problems. The second they see BTEX going up, they go out and we haven't had a false detect. So they're basically, as soon as they see something, they go out and they find the problem, and if they can, they fix it within an hour or 2. And so they don't even get to the problem of getting these high releases. And that's pretty much all I have to say. I'll be happy to answer any questions on this. So thank you.
So next up is Don Gamiles. Don is the founder and chief technology officer for Argos Scientific Incorporated. Dr. Gamiles has been involved in the field of fence line and community air monitoring for over 30 years, which has included working for the Department of Energy and the U.S. Army, where he spent 4 years as a weapons inspector for the United Nations in Iraq. Argos operates air monitoring stations worldwide and is currently contracted to operate and maintain the Benicia Community Air Monitoring Program in Benicia and also the Porter Ranch Community Air Monitoring Program in Porter Ranch. So I'll hand it over to you, Don.
I'm asked to give just kind of a quick update as to the work Argos has been doing with open path hydrogen sulfide air monitoring systems. And it's again been a great technology, and we're seeing some really interesting what we're able to do with it. Before we get to that, I do want to just kind of give a quick history of fence line monitoring in the Bay Area. And, you know, again, for better or for worse, you guys have been dealing with fence line monitoring longer than any other community in the world right now. You know, the very first of one of these that came up, obviously, was the Unocal refinery in 1996. For those of us who have been around, that was when the World Wide Web was beginning to actually come into existence. We were asked in 2007 to install a fence line monitoring system at Marathon and the acid plant there. And that's when, you know, Facebook and Twitter appeared. In 2012, obviously, the Chevron Richmond fire, you know, and in technology world, that's when Apple introduced the iPhone Model 5. By 2015, you know, the Air District Bay Area had put it together, their first fence line refinery rule. From a technology standpoint, virtual reality was actually kind of show up. And in 2023, you know, when the H2S specific rule for Bay Area was put into place, that's when we started to see advancements in AI and things like ChatGPT and generative artificial intelligence. The reason I want to bring all this up and why it's important is kind of what we at Argos are trying to do with the technologies that we're currently working with. And in a lot of ways, many of the fence line systems, and you know, Jochen sort of alluded to it, he would use a commercially available technology if it was working the way he felt it could work, and that's when he went out and built his own system. You know, to be quite honest, a lot of the systems that are in operation today operate the same way as the ones that were in 1996. They still require field personnel to go on site to perform calibrations. Data has to be reviewed by humans to check data quality. People have to go out to do maintenance on fixed schedules. And, you know, even when it's gotten to the point of doing remote operation, it still requires human intervention. And, you know, this kind of bothers us at Argos, and we really are trying to do our best to embrace the future. And a lot of that is just why settle for kind of what's good enough? I mean, the air districts put out rules that say you have to meet certain detection limits and things like that, but why not push things to be even better? Why not evolve the way technology has evolved over time? That's why we've worked with leaders such as the people at UCLA in doing the things. It's also why we sought out early on innovators such as Air Optics, who are developing the H2S system that is currently being used at MRC and other places. And then also the thing that we're really working with these days is to partner with community research groups in the field of artificial intelligence, machine learning, robotics, edge computing, to just see how we can integrate those approaches into what we're doing with these fence line technologies. And the one that really works great for this kind of thing are these H2S air monitoring systems that Air Optics has developed. You know, and what's the payoff? I mean, why do this? Well, the reality is, if we start combining all of those things together, we've gotten it to the point now where these systems can actually analyze their own data and tell us when they need servicing. We don't have to go out and do it on a fixed schedule. We still do that. But the systems are getting smart enough to let us know when that's actually happening. Much like what Johann's doing in the US, what we're doing overseas is in deploying a lot of these techniques on fence line systems internationally, and we get the exact same effect that Dr. Stutz had, where the refinery operators are now getting the data in a manner and having high enough trust in the quality of the data that they'll actually go out and fix detection. Once we tell them that something's been detected and possibly where it is, within 15 minutes, they're out there fixing it. And it's amazing how we've seen the decreases in emissions occur for all sorts of gases because of that. Also, these intelligent air monitoring systems, again, they can calibrate themselves. We haven't fixed, as Marilyn brought up, there's quality assurance plans, and obviously we follow those. But the intelligent systems now know when they can check themselves, and we actually have them doing that on an automated basis. It's
Okay.
very interesting and kind of fun to watch. The benefit to that is, as I mentioned, the refineries are using this information to send crews out to mitigate leaks. This is so much better to mitigate a leak and fix it before a large event actually occurs. A lot of the information we're getting now is being used by the data scientists that we work with to, assist them in doing health studies. Down in Porter Ranch, which is where UCLA and Argos are currently working we've been sponsored by South Coast to install a community monitoring network. The communities get real-time notifications when an event occurs, and it's actually, they use this information all the time. And in certain parts, other countries now, these systems, the quality of the data is so good that the regulatory agencies are actually using them for enforcement. So, we're really watching these smart systems evolve. An example of this is, so for example, in the Bay Area, the regulation says that we're supposed to collect data every 5 minutes and report that data. But as an example of how you can use these systems and really push beyond just what the regulators are asking us to do, the systems that, these air optic systems, the beauty of them is they put out very high quality data with sample times of 1 second. Now, that's getting information so quickly that humans can't really keep up with the data. And that's why we're working with a lot of researchers right now to actually employ artificial intelligence now to actually grab this data and help us understand what we can do with it. And an example of this is this little case study where we actually had the system set up in between two sources of hydrogen sulfide.
Did he respond?
One is an industrial facility and the other one was a wastewater facility. And what we were doing was we were measuring the data in 1 second time intervals. And again, the data quality at 1 second is as good as the 5-minute average data. With this system, and we'll quickly kind of go to the end, we were actually able to measure the two different, because we were doing 1 second data, we were actually able to identify the source of hydrogen sulfide to actually be two different sources, one from each of the places, potential sources, and within 5 minutes, if we were using 5-minute data, we wouldn't have been able to do that identification. So that's the end of my presentation. I just wanted to quickly say that these systems are really, really amazing. And again, we're really, things we're learning and seeing no one's ever been able to see before with a system of this nature. Thank you.
It boils down to this. We're seeing what they're doing in LA. Yes, please, we want it. We've got the obstacle tenting. We want it coupled with health assessment studies. We want the refineries to do better. We want the air district to do better to enforce Rule 15. So that's what I had written in about a page or so, but that's the message that BCAMP wants to share with the community.
And I'll just, I got 1 minute. Okay, it is possible to have a networked, regional, independent monitoring system where all data from all sources of data collection are seen on one available public access website. This is possible, and the district has been collecting money since 2016, under Rule 15, approximately $150,000 per year per refinery, and over a 6-year period, this represents about $6 million that is saved for the purpose of establishing in every North Bay refinery corridor community a monitoring station like what we have in Benicia right now. It took too long to get it, but it's great, and if we connect our system to other North Bay community stations, we'll have a greater picture than the Air District right now has of the whole condition of, and with more specificity than we have now, or they have at their disposal. So we envision a regional network system, and we're going to model that in Benicia with a network system here. So that's our good news.
There are places now where you can go online to get good data, BCAMP has a website. If you go onto that website and you look under report and issue, you'll find ways to get notifications, and we have links to all different, from all different groups, like the fire department, both counties. Also, there are a couple of phone apps. Smell My City phone app ties directly into BCAMP data and will send notifications once chemicals exceed certain health levels. And we also have a whole bunch of information about where to report an incident. So please check out our website. Please look under that tab, report an incident or report an issue. And also the BACMed has a website. If you look up on the upper right-hand side, it says air monitoring data. The lower left-hand side says complaints. So please use that. We have 2 members tonight that are on BACMed's board, Steve Young and Monica Brown. So we want to thank you for coming.